I meant more just penis and vagina is not
Yes.
important to everybody. But intimacy 100% is, it's just that everybody gets it in different ways. And as long as it's not, for some people, causing like a physical issue, then, I think that's when you would treat it. And, or if they're bringing it up, like we're sexually active all the time and it's hurting, I can't anymore. That's a big problem.
Tanya, you sent me all excited about this article from Dr. Rachel Rubin, something about, what did you just call the title? Like
Vaginal dryness can be fatal.
Can be fatal. Like that's pretty extreme, that kind of exclamation on something.
Right.
But the thing is, it's true because, there is a premise that dryness is killing women, like literally killing women. You have some stats on that, right?
Yeah. What does that even mean? So she basically said this condition, which we'll get into, called genitourinary syndrome of menopause, is killing women through all the bladder infections that can result from that. Apparently 7 million visits and hospitalizations happen annually, and 25% of all infections are in older people or from bladder infections. And then stranger than that, I didn't know, is a third of the total Medicare expenditure in the US is around bladder infections. So although, those are the stats on why vaginal dryness can be fatal, we'll kind of go into like, how does that relate, right? These bladder infections are actually happening because of genitourinary syndrome of menopause, which isn't addressed. And we should just call it vaginal dryness or vaginal burning. So women would show up in the office and we just write that down and recommend perhaps, personal moisturizers or lubricants for intimacy, but that's not enough. So why isn't it not enough? Because we have all these receptors for estrogen in our bladder, which I didn't know. And then, of course, in the vaginal area and also in the urinary tract. Did you know that we actually have, we talked about it before, but in the urethra. So the urine exits through that tube, right, called the urethra, and there's estrogen receptors in there.
Mm-hmm.
So they change when we lose estrogen. The actual urinary tract and the bladder because of the lack of estrogen after menopause. So genitourinary syndrome of menopause is this all-encompassing syndrome that was actually a term that started to be used in 2014, Dr. Rachel Rubin mentions in her article in Medscape, and that doctors aren't really knowledgeable about it. And so they end up kind of dismissing it and might not necessarily make a recommendation for vaginal estrogen. And the focus is more on, let's see what we can do before we even go to vaginal estrogen, right? Even in this course I took in the North American Menopause Society, the first step is if there's no vasomotor symptoms, so no hot flushes or night sweats, just try the best that you can to use moisturizers and, personal lubricants. And then only then, if it's not working, go with vaginal estrogen.
Right. So let's go back for 1 second, though, because people are like, what? What are you talking about estrogen receptors? So estrogen receptors are basically a group of protein inside cells, and they get activated by estrogen. It binds to, and then it helps it work better. So, you're speaking to the urethra, which what? How did that come? Who knew that it was there? But really, estrogen receptors are found all over the body, and it includes tissues as diverse as in the bone, in the brain, in the liver,
Yes.
and colon, and skin, and salivary glands. It's everywhere. But we only thought of it as the reproductive organs, and that's it. But that's not true. Hence, that's why as we get older, you'll actually literally see even bone loss in the face. I don't know if you've ever noticed some elderly women with these smaller chins, right? And then why do things start to sag? Because we have less bone to have it be held up. So
right.
It's real.
Yeah, we just look leaner, but really it's actually lipodystrophy. We're losing fat cells in our face, and our bones are degenerating in our face.
So it's there's lots of things to do to actually help it naturally. And you pointed to specifically, it's okay, if it gets bad enough and if you're in full-blown menopause, really, the only thing is estrogen, right?
Right.
Because that's the problem.
So there's different types of estrogen, and there are other ways you can treat it, like DHEA and testosterone or other options if there's painful intercourse. And then there's this ospemifene, which is a SERM, like it's an oral medication. And then the estrogen comes in different forms like vaginal rings, vaginal tablets and creams. But you're right. So estrogen would be the primary, kind of like the first go-to. But you can use DHEA as well. And there are testosterone receptors on the outside as well. So actually more as you get to the outside. So, women who have issues with libido or pain can use the DHEA or testosterone to improve the dyspareunia or the painful coitus. But if there's this whole syndrome of menopause called GSM, then, you're increasing your risks for bladder infections and just life of uncomfortable and quality of life. It doesn't actually get better, unfortunately. It actually progresses. So apparently the research doesn't support being proactive and treating it ahead of time, because no one's tested that to say, okay, well, should all women go on estrogen then, as soon as they are done menstruating? I don't think that's the answer, but I think that we shouldn't delay. And if someone has it, like delay treatments. And if somebody has it, then it shouldn't be, let's try vaginal moisturizers first. If it's progressing already, then there's a combination of the estrogen, because estrogen's local. It's a safe treatment. It's effective when you do the vaginal estrogen. Some women are on the rings or the tablets or the creams. So I think that the biggest fear is that this misconception around using vaginal or any kind of estrogen, like systemic estrogen, and breast cancer. So if that's the fear, even though it's a misconception, a woman could know, okay, if I use vaginal estrogen, it doesn't go systemic. It doesn't even show up in their blood work if they were to test. It stays local, and then it can prevent this burden on them and their quality of life, and then on the medical system in terms of bladder infections and all these visits and hospitalizations because of it, right?
So you bring such a good point. I just want to, hone in on that piece because, you and I are in the natural field. So don't we want to help people more naturally? Well, here's the scoop. Estrogen is natural because we naturally have it in our bodies, and it declines at a rapid rate as soon as we hit perimenopause, and then menopause, it's like, as you call it, falls off a cliff. So what do? Yes, there are, in Chinese medicine, we talk about yin deficiency. So it's like body fluid and blood deficiency. So there are herbs to help that. But at the end of the day, estrogen is estrogen. That's real. So we may need to supplement with that. Not necessarily every case in the world, because, we'll speak to this in another episode. But, when we look at these people there's the blue zones of the world where there are centenarians that live to 100. I don't think a lot of them are on estrogens, but it's like, how do we be vital so that we may not have to go there? But if we have to go there, we might just want to. Does that make sense what I'm saying?
Yeah. Yeah. No, 100%. I'm curious what they do in those scenarios, or maybe if their diet and lifestyle, I don't know if it's been investigated, but if their diet and lifestyle is what kind of wards off that, maybe the vaginal dryness. Do they age differently? I don't know. I haven't investigated to see if the centenarians don't suffer from bladder infections,
but we don't know this.
Painful coitus. We
don't know this because
Yes.
because these are generalized researchers and they're just looking at longevity as a whole.
Right.
So they may not necessarily look at, okay, well, what actually are you suffering from, even though you're living to 102? Right? We don't know this, but there's certain things that I can't wait for everyone to watch this because it'll come out in the new year. But it doesn't matter. Anyway, the point is, it's like they're looking at other kinds of lifestyle things that they're doing, right? Like exercise and what they're eating and the community that they're around and the faith that they have and all that kind of stuff. But anyway, we're totally getting sidetracked, but it's so interesting. So
for sure. Yeah. So vaginal dryness, pain with sex, worsening orgasm, the atrophy. So like the change in the actual vaginal lining, like the lining actually thins with age, but it's a more prominent in a big chunk of women, like 70% of women. Apparently 30% of women don't suffer. So maybe there's something that we don't know, like what's going on with that 30%. But if it's left untreated, then you're suffering and you could be potentially getting bladder infections. And, rather than just keep treating with antibiotics, it makes actually more sense to stop the, regression of the vaginal lining atrophy and the degeneration of the lining, and treat it with estrogen. And, there's historically, I think people are afraid of what's called CEE, or conjugated estrogens, which apparently are also so totally safe, but they did create a bioidentical type of estrogen. People think because it's prescribed by your medical doctor, it's not natural. So Vagifem, as an example, it's just a brand name versus, Premarin from pregnant horse's urine. Premarin there's a vaginal estrogen for that. And then there's also the bioidentical estrogen that your doctor can prescribe. It's estradiol. So it's exactly what our bodies make, but in a tablet or a cream or a vaginal ring. So I think it's important to recognize that bioidentical doesn't mean necessarily the hormones you're getting from the compounding pharmacy. They're also in medications. They're available, and they have been for years, even through your family doctor. People often associate bioidentical with naturopathic doctors, but medical doctors prescribe it, or can prescribe it as well.
Right. And so okay, that leads me to ask you two things. So one, can you as a naturopathic doctor prescribe estrogen right now?
Yes.
Okay.
So as a prescribing naturopathic doctor, so you have to have an additional license for that and do board exams for that. Yeah.
Now, two, before we go on, we just want to state that the disclaimer is that this is not medical advice. So really, you need to go to someone like Dr. Tanya Wild, who literally has been trained and has been certified as a specialist for menopause. So I would totally reach out to her. And so you can go do that through aliveholistichealth.ca. Just speak to Marie or Sue, and they'll get you in, and you can ask all the questions you need, or start by DMing us at Alive Holistic Health Clinic on Instagram. Okay.
Yeah, I would love to hear what people's biggest fears are around using hormone replacement or hormone therapy when because of the misconceptions that are out there. I would love to hear what people are still afraid of when it comes to estrogen therapy.
For sure. What I do hear now, though, is that women are learning about how the Nurses' Health study, when it came out, and then there was some looking at the data and going, oh my gosh, it causes cancer. And now we know that for sure that's not the case. So there's more evidence, more people talking about that was actually wrong conclusion. So hopefully that people will have more ease and feel more calm about going for estrogen. And the other part to this is that, 1901, we lived to, I think the average age was 48.9, something like that. Well, either way, under 50. Okay, 1901. Now, 2023, average women's lifespan in Canada is 84 years old. So we're way outliving our ancestors. So, that means that, so if you think about it, if you're dying at 50, you barely hit menopause. So there's no concern about menopausal symptoms.
Right. We spend 40% of our lives in the part after menopause. So we spend 40% of our lives post-menopause.
Well, I'd like to spend a lot more than that because I've decided to live till 104.
We will be centenarians together. That's fun.
Yeah. So, again, and I just want us to drive this home. And, I am a total natural person. I don't really take anything, but I've become, and I've supportive of estrogen therapy, because if I think about, gosh, if your iron's low, you take an iron supplement. You don't even think about it. You don't think, oh my gosh, is that natural? Is it this or that? Right? You don't. You just take it. But when it comes to estrogen, it's interesting that with this hormone, all of a sudden people are like, I don't know. Is it going to cause something bad? What are your thoughts around that?
Right. So it's not going to cause anything bad, because if it was going to cause something bad, then your own estrogen that spikes to 1,000 every month when you're a menstruating woman, that's when the bad thing would happen. Right. And most breast cancer, for example, happens in your 60s. It doesn't mean that it doesn't happen before that. But So if there's fear, then you'd be fearful of your own estrogen. So I think that's the difference, like understanding that what you're using in many cases is actually an identical match and a replacement. And when men, for example, when they have trouble, for example, peeing because maybe their prostates are swollen,
Which is very
they,
common as you
yes,
age. Mhm.
right?
Yes.
So then they will be prescribed Flomax, like you've heard of that, or Tamsulosin, which is like the generic name to help them pee. And then if they're having difficulty, maintaining or getting erections, they'll use Viagra. Well, those are not necessarily, I mean, they're safe and are used all the time. Well, for women, it's like vaginal estrogen and DHEA. Those are things we're missing. So we're actually just replacing the things that we're missing that we got to have naturally produced in the first half of our life. In the second half, it's no longer there. So replacing it, it's even safer in a way than using the Flomax and the Viagra for men. And it helps so much with achieving orgasm, preventing painful sex, and preventing bladder infections because bacteria love dry, irritated
Mm.
tissue, right?
Right. And so I just, again, want to educate in terms of like, how much estrogen is it, the same as when you're actually using it as birth control. It'd be much lower of a dose. Is that correct?
That is correct. Yes. And so it's actually like 10 micrograms, like little tiny miniature tablet, and you insert it daily for 2 weeks if you're somebody who's just experiencing these symptoms to kind of help regenerate. And then it's twice a week ongoing. And there comes, as I said, in different forms. So that's an example of a tablet that's bioidentical estradiol, which is type the E2. There's also a prescription of estrone, which I personally don't find as effective. It's E1, which we naturally make that estrogen in menopause. So to me, it makes more sense given that it doesn't seem to work clinically, but then also you're already making that E1 and it's not impacting that area, the vaginal area. Why would we replace with the E1 when the E2 is what seems to be effective? So the estradiol, and there are vaginal rings that you can insert and leave in, and it just releases a tiny microgram dose every day.
So do you have a personal opinion about which delivery is superior, or would you think that it's just dependent on each individual?
So I think I'll explain E3, which is estriol. According to the research, that's also just as effective as estradiol, the E2. Estriol is the hormone of pregnancy, and that comes in creams. And so for women who are experiencing bigger changes and they want to, on the outside, the vulva, you can actually insert it to the lower third and then outside the vaginal area on the vulva and on the urethra. And something that I learned recently that I didn't know either, which maybe, if you don't want to hear about what the changes are, the detailed changes are, then stop listening. But your urethra, which is the pee, essentially the pee hole, like where you pee, because of the lack of estrogen, in some women, they can have these little carbuncles, like the urethra actually just exits and then folds on itself like a little hernia of the urethra. And then if it's really bad, it telescopes, like literally pops out. So it's like a hernia of the urethra. So if you're having that kind of finding where you're actually seeing, like if you take a mirror, I mean, how often do we tell patients, take a mirror and look down at your vaginal area just to get a baseline? This is what's normal. And then over time to see if there's changes, right? So I think it's a good thing to check in a couple of times a year just to say, okay, this is what I look like. And if there are big changes, like all of a sudden you're seeing where the pee comes out, it's looking like a little like a pimple almost there. That
Wow.
could be the urethra inverting on itself. Yeah. And then, so if that's the case, then that's why you're like, yeah, I don't want to, some people don't want to know this stuff, but these are things that, the other thing that can happen is that the vaginal, the actual, the opening, the introitus, we call it, it shrinks on itself. And then the urethra gets closer to the vaginal hole. So it all kind of,
Right. But that's
yeah.
part of the atrophying. Things are like
Yes,
shrinking and
yes.
shriveling. So I want to bring this point in because we were talking about, some of these people that are centenarians, it's like, and if they're having a good life and they're not taking estrogens, well, what are they doing? Well, I wonder, are they just using the downstairs more? Are they having more sex? Are they
Yeah,
utilizing it so that they're not atrophying the
right.
muscles?
Yes, that's a great point, because if you're actively using, meaning like you're being sexually intimate and but there's penetration, that keeps the area circulating. And if for some reason, there's issues and pain and you're able to fix that with estrogen, it's important to, gradually ease back into that. You can use vaginal dilators and smaller and use them bigger ones as time goes on. There's actually therapy for that, so that eventually you're using a dilator the size of your partner's penis. So and then eventually there's no pain. So like if you're literally like more active versus sometimes what ends up happening is you're just so inactive that you get to the place where you're like raising kids and you're so distracted. And now you're
Yes.
like, okay, yes, I want this back, but things have shifted down there.
Yes.
So
Yeah.
you have to, sometimes involve help and not be embarrassed to ask about it.
Absolutely. Well, I love the spicy conversation, by the way. And so, I mean, but here's the thing, right? Like, if you stop working out, and this is what happens: you get pregnant, you then just don't even want to have sex because you're too busy chasing a little toddler around, and like nothing's going on downstairs, right? You're breastfeeding, like everything's going on upstairs and in the brain because you're like rah, running around, but nothing's going on downstairs. Just like your muscles, if you stop working out, those muscles are going to get flabby and like, just not doing much. So the same would go downstairs.
Yeah. They actually recommend, the North American Menopause Society says, get a wand and use it at first to just improve circulation. So if you can learn, like, let's say you're having issues with orgasms, it could be that shift in hormones, but it could also be the change in activity. And what matters more in that case is it's actually more of a mental game, right? So if you're not able to achieve orgasms, it could be that you're just so distracted with life. And then there's been less circulation down there. So it's like kind of doing the mental therapy, maybe cognitive behavioral therapy, talking and doing a dump to somebody to, get your emotions out and talk that through. And then also physically on your own, working with self-masturbation or using a wand to improve circulation so that the tissue starts to plump back up and then you're more comfortable. And then obviously working on talk therapy with your husband. So it's not just about estrogen in that case, if there's issues with orgasms, but the actual dryness piece can trigger pain and or if you have burning or atrophy, that can also cause a disconnect, right? Because you've got all these other factors emotionally. Now you've got physical symptoms and this big cycle going on.
Oh, love this. And, coming from a TCM point of view, I mentioned earlier in our podcast about how there's that dryness. It is natural where like the body fluids literally start to get less. If you think about grapes and raisins, does not tell it all. So it's like, how do we juice everything back up a bit more? So with the estrogens, with the movement, with the exercise, with the wand, and in acupuncture, how we can actually increase blood flow downstairs. That is a possibility. Now, for men, I haven't really used this on women. I'm not going to say this, but I have used this on men. So there's a point. Okay, everybody. Okay, everybody. Like in the perineum. And oh my gosh, like, so for men that have so whether prostate issues as well as like erectile dysfunction, I've used it. And it's like, oh my gosh, Mary, I'm like a little boy all of a sudden again, because it's getting things flowing.
Yes. It's
Which
an
is
awkward
very cool.
point to needle. You have to have him hold everything up, right?
No, no,
No?
no.
No, you
They're
don't do
lying
that?
down, face down,
Oh, face
and
down. Oh,
or
so
on the
then
side. Yeah. So like,
oh,
and then
okay.
you just,
I
it's
see.
through the backside because
Mhm,
it's
mhm.
between the anus and the
So it's on the
backside.
perineum, right? The
Yeah,
anus
the
and
perineum. Yeah,
the
perineum.
scrotum,
However
right?
you
Yes.
tomato, tomato, whatever.
Right. So that's
So
actually a very helpful point to explore as a partner
yes,
too.
I was going to say as an
Acupressure.
acupressure point. So with
Yes.
your
Oh,
partner or
good.
by yourself. Okay,
Yes.
because it's not very typical that acupuncturists will do this.
Mhm.
But
Agree.
it's totally possible, and but like you can literally press on it at home on your own or with a partner or with the wand even too.
Right. So both men and women.
Yes. I told
Yes.
you things are getting spicy around here.
Right.
Woo!
Yes. So no, I think that, you have to think of all the factors. A big one is all those hormone shifts, like us as women we make 50% less testosterone in our 40s compared to our 20s as well. But that keeps going like it maintains. So we still have more testosterone as we go through postmenopause, and we don't totally plummet in testosterone, which is nice, but it does drop by half. And testosterone, as you know, is the libido and arousal, sexual drive hormone. So if that's cutting in half, we have that factor, and then menopause hits and no more estrogen.
Yes, but then this is where it comes in. So now all of a sudden testosterone to estrogen ratio is very different. Hence,
Yes.
we're more assertive. We're
Yes.
more wise. Right? There are benefits,
There
right?
are. Yeah. So there's positives, there's pros and cons to that too, as men are kind of going through their andropause phase. Their testosterone's declining. Their estrogen is therefore more present because men have estrogen too.
Yes, they
And
become more lovely.
yes,
Sometimes.
and they want to talk and communicate. The downside is that women are like, yeah, I don't want to listen, like because their testosterone's
You're
more
like
present. They're like,
intolerant. We're like,
yes,
that's it. I'm done. I'm done
right,
with this. Like,
right.
talk
So
to
you're
different
like
men.
raising children, and maybe you've had a struggle with fertility. You're now raising children, and then you're like disconnected. So it's like reconnecting because then you want to really enjoy that second half of your life, right? So not just necessarily from a prevent bladder infection perspective, or that your vaginal introitus is closing. It's nice to have that connection with your partner. Now, maybe the other side of the centenarians, you're saying maybe they're more sexually active. Maybe they're just so inactive that it's not a problem and it's not a concern. Because that's the other thing to think about with GSM is that you only treat the women who are, apparently this is what they say, is like either they're having the reoccurring infections or that they're really uncomfortable and they're sexually active. I mean, if someone says, I was sexually active 2 years ago, I'm not having bladder infections, and you're doing a clinical exam and their vaginal lining looks a bit dry, but it's not, like there's no issues with the urethra and they're fine and they're not complaining about intimacy, then you're not going to treat, right? Like
Oh my gosh.
that's
You bring such an amazing point. I'm sorry, like I'm jumping in, but like these places that are blue zones in the world, these are centenarians. They live in isolated parts of the world, so it's not like they're going to be going for physicals every year, right? So they wouldn't even know because
No.
even if it's atrophy, like they're not getting a speculum up them, so they wouldn't even know that they're hurting or dry or anything. Like who cares? It's like I'm closed for business. It doesn't matter.
Yes, maybe as they're growing wiser, they're like, we don't need intimacy.
Yeah.
I mean, I always think of, vitality and energy as people who are still physically intimate in that connection, but not everybody's physical touch. So you have to just look at everything, the holistic picture, right? Not everybody's it's not going to be important to everybody.
Well, no, I'm not going to say it's not important, but intimacy is different for different people. So for
Different.
these centenarians,
Yes.
it's their family. So it's like
Right.
they're intimate with their family and they connect and they cook together and they eat
Yes.
together and they go to appointments together. So
Right.
that is intimacy.
I meant more
Different.
just penis and vagina is not
Yes.
important to everybody. But intimacy 100% is it's just that everybody gets it in different ways. And as long as it's not, for some people, causing like a physical issue, then, I think that's when you would treat it. And, or if they're bringing it up, like we're sexually active all the time and it's hurting, I can't anymore. That's a big problem. And you can't treat that by just, silicone, which is, the best kind of personal lubricant. Other ones like the oil-based ones and water-based ones, they often irritate or cause yeast or bacterial vaginosis. Silicone is like a plain personal lubricant. That and or vaginal moisturizers. If that's not enough, then really like you should be using estrogen for sure.
Love that. That's a really great tip. Now, so from a TCM standpoint, the tip in terms of like, if we're starting to experience dryness or vaginal itching or whatever it is, we want to nourish, like from a herbal standpoint, it's about, again, nourishing that kidney essence, the jing, the body fluids. So I'll list 2 patent herbal medicines that we can use, but really you want to go see an herbalist, like go see Kim Alive, and he'll prescribe you something very individualized. But just as like a a patent one that you can easily get, Liu Hui Di Huang Wan. Okay, that's a bit of a mouthful. And then there's another one called Zhuo Gui Wan. So Zhuo Gui Wan has 8 ingredients. Liu Hui Di Huang Wan is 6 ingredients. And typically those are not meant to be just used as is. And again, it's about like adding certain ingredients in or taking out certain ingredients or like having different amounts of ingredients, just as you would with making a flexible recipe, because you'll add certain things, you'll take away certain things, and it's individualized so that it can help you get on your way and have you be more juicy everywhere.
I was just going to mention that although estrogen is indicated for the genitourinary syndrome of menopause as like the number one kind of treatment, is the only thing that's going to stop its progression according to the literature, they don't study TCM herbs enough to see what kind of difference. So you can always see if that's enough, and it can help you systemically, especially for that person who's starting to notice when you're in perimenopause, because maybe it's not indicated yet for you to be using the vaginal estrogen because you're making your own. In some cases, you can do both, since then you can like work systemically with the herbs and the vaginal estrogen if it's really, troubling you. Something that also happens that women will notice postpartum is stress incontinence and overactive bladder and urge incontinence. And I want to make note that stress incontinence is one place where estrogen actually can make it worse. So if you're like coughing, how you mentioned when we were chatting, like, when you cough and you pee, or you're jumping on a trampoline and you pee, it's more helpful in those scenarios to actually, go for acupuncture and or physical therapy, pelvic floor physiotherapy to help work on retraining your Kegel muscles. And even urge incontinence, there's a small select group of women who can benefit from estrogen, but it's again more the physiotherapy that can help. The pelvic floor physiotherapist can help you retrain your detrusor muscle, which is in your bladder. And acupuncture is also on the list, according to North American Menopause Society, to help with that urge incontinence where you have like a big flood of pee out of nowhere. Stress incontinence is like little leaks of urine when you're jumping on a trampoline, which that happened to be. Oh my goodness. I had no idea. I was like jumping at Sky Zone and I was like, whoa, I better stop.
I've done that.
Then I went to the pelvic floor physio to understand myself better. Like I think it's really important, and women don't do that enough. I mean, there's a lot more physiotherapists popping up everywhere, which is awesome. Yes. Because we're recognizing the impact. And then acupuncture can make a big difference with the stress incontinence. Maybe can you speak to that piece?
About the acupuncture?
Yeah, for stress incontinence. Yeah.
Oh, so for sure.
How you can use just maybe to speak to like what kind of diagnosis that would be, and then like acupuncture points that you might be looking at.
Yeah, so it can still be back to the kidney and liver, but also it could be spleen. Spleen, we say it's about uplifting the energy. So if it's deficient and lacking, then things can prolapse and go downwards. So which includes, peeing like little squirts of pee when you don't want it to. And here's the truth, like in terms of stages of life, when we have a child, when we have postpartum, like the act of childbirth, it's the most energy consuming activity a woman goes through. And it depletes the essence dramatically. So you're in a depleted state postpartum. So it's really important to nourish and to tonify. And that also goes with all the muscles, because that's been utilized and now it's in a weakened state. And again, we're, focusing on breastfeeding and all the other things. So your whole, we call it lower jiao, your lower part of the body is just not being utilized because it's kind of in a quietened state. So we need to nourish it and revitalize it. And so when people say, oh gosh, like I got back to my figure at 3 months postpartum, I'll say, please don't strive for that. That's just not what we should aim for, because really postpartum can be like up to 2 years. Like we just need to be gentle and kind and slowly nourish ourselves back to health. And when we say nourish back to health, it doesn't mean nourish yourself back to what you want to be, which is preconception. Like we need to embrace the menopause, or sorry, the mama body, right? Like it's different. Do you wanna add to this?
Yeah, no, I fully agree, and I never put that pressure on myself postpartum. I always gave myself, like, a good year. I know that, it's a big social media thing, "Back to my body in 3 months," and I was like, "No, I wanna enjoy baby, and I wanna just gradually ease into this," and I think it's a really important time to get like, we often think, "Okay, get pregnant, be pregnant, like, get that support through that time," but postpartum is such an important time to get that extra care. Like all the moms get all the extra care in pregnancy and they eat clean and well, many, and then they'll go for massages, but then and acupuncture, but then it'll all drop off.
Yes.
I think it's important to keep going because it's in that phase where you need that energy. Like you're saying, the biggest energy is in labor. But for me, and for I see with many women, breastfeeding
Oh,
it can be
yes.
very depleting. And so just like
Yes.
rechanneling your energy with nutritious food and acupuncture and downtime and like you're up all night and so it's like finding ways to kind of, make it so that by the year mark, you are able to kind of get back your body. And you're right, it won't be ever the same it'll be different. But I think, our bodies shift in so many ways that it's not just pregnancy that makes those shifts,
Yeah, and I love
we'll
that
talk
you
to.
say this because, it's 100% true. You do everything for yourself in preparation for when the baby gets here, but then when the baby comes, it's like everything's lost for yourself. You can barely go pee. It's like someone was telling me, "Oh, I went to the shower and I was singing Wheels on the Bus Go Round and Round," right? With the baby in the thing while she's showering. It's like, "Oh my gosh, see, like zero time," right? So it's like, no, it's 2023. We need to be different. We need to do better because there's a couple of reasons. One, we don't have the community. We don't have the village. We don't live in that small town where you have like a whole like 20 women taking care of your kid, right? And you, right? We're all in these independent units and like we're expected to do everything and we put that pressure on ourselves. And we're also working moms now too, right? So it's like we have to stop that and actually say, oh, and not feel guilty about taking care of ourselves because it's actually a necessity. It's not just it's not a given that you're going to be good. You have to make the commitment and make it happen. And it will require a team around you, whether it's friends, family, colleagues, but even hired help, like what you mentioned, the pelvic floor people, the naturopaths like yourself, acupuncturists like myself. Like, it's like, we are here all for you. So like you got to use it to your advantage so that you can celebrate this life without feeling guilty and without feeling overly tired, which you're going to be anyway. But, we want you to thrive in your life. Like, hello, don't we deserve that? And won't that help your baby or babies thrive better too when you're in a better place? Anyway, I just had to throw that in there.
No, I fully agree. So well said. So, if you like this episode, please subscribe and share and tell us what topics you want us to cover. And if you have any questions for us, reach out to Alive Holistic Health Clinic. You can reach out to Barry or her other acupuncturists, we're all an amazing team. And we, with your permission, talk about your case to make sure that we're not missing a thing. And we share our successes. And if there's any bumps in the road, then we tweak and we make changes. And I'm Dr. Tanya Wild, naturopathic doctor. So please reach out to us if you have any questions.